The Disability Benefits 101 Interview Project. Our Path to Common Sense. This is an interview with businesswoman Alana Theriault, owner of Express Independence, serving customers in the San Francisco Bay Area. Disability Benefits 101 Information Services produced the interview for an audience that includes Californians and Americans with disabilities, their family members, and for policymakers. The World Institute on Disability is grateful to the California Endowment for production funding. Alana is interviewed by her colleague Rachel Stewart of the California Health Incentives Improvement Project. The Path.
So Alana, thanks for taking the time to meet with us today. I'd like to start off by having you tell a little bit about yourself and your background.
Okay, well, I grew up in California, a transplant from the East Coast. And I moved here with my family, my mother and father, and I have a younger sister and brother. With health problems by the time I was 15, I was in a nursing home. My family couldn't care for me anymore. I lived in a nursing home for about a little over a year and then moved to Berkeley with the assistance of some dear friends who also have disabilities. Learned about independent living directly from them. That was back in 1982.
So what do you do for work?
For work, I am a benefits counselor. I've been doing this since 1995. I assist people with all types of disabilities, negotiating with their public benefits, SSI, which is Supplemental Security Income, or they're on Social Security Disability Insurance, or SSDI, Medi-Cal, Medicare, basically the benefits that they use for health care and cash to live independently.
How did you get to this point in your career?
Well, I was very young when I moved here and started volunteering at my local independent living center. I picked up volunteer jobs at, for example, a food co-op. I was doing cashiering and ordering supplies. I did grant writing for a theater company and a rape crisis center. I've had a hodgepodge of different kind of community service jobs over the years, with each job picking up a still here, a still there, which has led me into some leadership positions. I've done a lot of different kinds of work, but I always have seemed to come back to the independent living movement and have been really interested in helping disabled people be as independent as possible. A job opening came up to be a benefits counselor. Have been doing that since 1995.
Working today.
Help me understand a little bit more about your business model. Who comes to you for services? What do you help them with exactly?
Okay, well, let me give you a few examples. Well, first off, I can tell you, people come to me because they have a problem. They're scared, they don't understand something, they're being given contradictory information, any number of those situations, sometimes all of them at once. I've had a number of other people I worked with who have been on benefits for a long time. They're independent, they know how to manage their disabilities, and they're ready to go to work or go back to work, depending on their situation. But they don't know how to approach work and maintain the benefits that they have. Maybe they're on medication and they can't afford to lose access to that medication. So I teach them how to use tools. My health has deteriorated over the years, and I just don't have the stamina or the consistency to hold a 9 to 5 or even part-time office job with regular hours. I need flexibility, and most of my work is either verbal or written, so I've been able to set up my home office and do benefits counseling via email, instant messaging, on the phone, and occasionally meeting people in person. And it's worked really great for me and for my clients.
So can you explain what happens after people come to you for services and get the information they were looking for? What is their next step?
They have a couple choices. They have a choice to work or not work. I was recently working with a fellow who was trying to save up money to buy a truck and wanted to use a PASS plan, a plan to achieve self-support, which is a Social Security work incentive. And so he and I were working together to do that. But because he knew what he was doing, he took the internship, which led to the temporary appointment in his job, which has led increasingly to higher salaries. And before we were able to submit his PASS plan, he abandoned it. He decided he didn't need it because he took the leap, he got the job, and he's getting promoted, and he'll very soon he'll have a permanent job, which is a great story, and he knows that he'll be able to afford to buy the truck without the benefit of a PASS plan. So it's really exciting to see someone in his situation taking that leap. Of course, there's the other half of the people who are just not ready yet. They just need information, they need to digest it for a while, and then maybe later they'll be ready to take the leap. But I don't lie to them. It's a complicated thing to do. You go to work, you have to follow rules. And then they're complex rules, so that's what happens.
Alana, before you became comfortable with the rules and restrictions associated with the programs you're in, what risks did you take?
When an opportunity came up that I couldn't pass up, I just bit the bullet. I jumped in and took the job. It was a full-time job at the Independent Living Center, and I realized that the task would somehow affect my SSI. I didn't know how, but I figured a lot of other people I knew were doing it, so there must be a way to make it work. I did that, but I refused the employer-sponsored health insurance because I felt like I had an option, and it was very frightening to me to possibly jeopardize my Medicaid, which is connected to my attendant services. Later, I took the health insurance with the job, and I benefited from having it. I got higher quality care. I got to choose my providers. And when I had to quit my job due to health, I was still able to keep my employer health insurance with Medicaid supplementing it under COBRA. And I was able to keep it for 18 months, and the Medicaid system helped me pay those premiums. So, but I didn't know how to do that before. Once I learned how to do it, I was really able to benefit from those programs.
Does it take a lot of time to work with private and public health insurance?
It takes an awful lot of time. Probably, but right now in my life, it's taken 15 to 30 hours a month for me to deal with getting the state to be up to date on what private health insurance I have, I get denial letters for payment from the insurance company, and I have to either appeal or track it back to Medi-Cal and get them to pay the co-payment. It's very time consuming.
Are all these activities done during normal business hours?
They have to be. It takes me 3 hours to get up in the morning, so that leaves from 10 or 11 a.m. till 5 o'clock p.m. for me to get a hold of the right people at the right bureaucracy to resolve a problem I'm having. So that's all happening during business hours.
Back to your business, what is your favorite part of the work you do?
Seeing the light bulb go on over someone's head when they finally get it. It's I understand what they're asking for from me, or so I can work. I mean, it's really exciting for me to see people be able to push aside their anxiety, their fear about jeopardizing the stability of their health care and their tax benefits, and that they can actually go out and do what they've been wanting to do for a long time, which is have that dream job or even have that very basic first step job and go out there and do it. They have a paycheck in their hands for the first time. And then I say, come to me when you get that first paycheck. We'll go over the rules again. They're able to afford something that they've never been able to afford before.
Yeah.
You know, I mean, and I'm not talking about luxury items. I'm talking about pretty basic things.
Yeah.
Common sense rules.
What would make it easier for you to do your job?
First off, I would love some continuity between the support programs. That all the cash benefits had the same set of rules. All the health benefits had the same set of rules. They were in understandable language that people could follow. Also, having a tool, a consistent tool that is looked at as the authority, something on the internet, such as the disabilitybenefits101.org webpage. If that was agreed upon to be the place to go to get the right answer, we wouldn't have people having the experience of being told 5 different things by 5 different people, not knowing which is the right answer, which is what's happening right now.
Throughout the course of our conversation, I was thinking of the fact that to get the health coverage that we need, we had to prove that we were too disabled to work. Yet now I have a good job in Sacramento and you own your own business. There seems like somewhat of an inconsistency here. What are your thoughts on that?
There's a huge inconsistency here in that in order for us to be able to be eligible for the cash and health care benefits that disabled people need, particularly the health care benefits that disabled people need to live independently, we have to prove we're too disabled to work. And those very same programs that dictate these rules to say we must be too disabled to work have created additional programs saying, but when you do work, if you follow these rules, you can keep this or that health benefit. My vision for moving past these problems that we're having with policy inconsistencies is to have a system that allows me and other disabled people to move seamlessly back and forth in and out of employment as suited to our lives, our disabilities, without jeopardizing our health care. We can go on and off cash benefits as we need to, whether it be workers' comp, state disability, Social Security benefits. Those things are there for us to access, but we need them to be separated from our eligibility for health care. Because whether I'm working or not, I need someone to come in, get me dressed, bathe me, make sure I eat, and help me tidy my house. And that doesn't change. I need this working or not. People with disabilities need their medications, whether they're working or not. So this needs to be separated from employment. Cash and healthcare are 2 separate issues. And right now they're merged together and they're intricately dependent upon each other. And the rules that allow us to separate them a little bit are too complicated for people to understand. I have a hard time understanding them, so I don't expect people who don't do this for a living to be able to understand this. So my vision is to have that problem go away.
And how do you see your role in this vision?
I see myself as a facilitator. I am on both sides to some degree of this problem. I understand the policies. That's a gift I have. It's something I've worked for, and it's something I enjoy doing. I want the policy side to understand what the day-to-day experience of that policy is like. I want the day-to-day people experiencing this to know why the policies are there if they want to know. I want them to be able to access the programs that they need. I want both sides to talk to each other.
In 2004, the U.S. employment rate of working-age people with a disability was 37.5%, compared to 77.8% for those without disabilities. 700,000 Californians with disabilities have no health coverage. Produced by the Disability Benefits 101 Interview Project. A program of WID, the World Institute on Disability. Sponsored by the California Endowment. A Rhyming Leaf production. Disability Benefits 101, Working with a Disability in California. Learn more at www.db101.org.